Hi, I'm Dr. Green, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at the Scottsdale Corridor, which is a gorgeous development in North Scottsdale built a few years ago. It has an Apple store in it, a Dominic Steakhouse, which is great, multiple restaurants, shopping, nightclubs. It really is a fabulous development, and it was built right in the heart of the recession. The story, as I understand it, is that Scottsdale got upset that Kierland gives all of its tax sales revenue to Phoenix. And it's right across the street, like 100 yards. So in response, Scottsdale went ahead and built the corridor, which is doing very well. It's a lot of parking. I mean, it's a gorgeous establishment. So at any rate, the topic for today is TENS units. What are they? Some frequently asked questions. A TENS unit stands for transcutaneous electrical nerve stimulation. It's a small device about the size of an iPod. I'll give you an example. This is not a TENS unit, but it's the microphone for this, and that's exactly what a TENS unit looks like, same size. So you can wear it in your pocket, on your belt, and it works really, really great. It can decrease the amount of narcotics that a patient needs. It can provide an inexpensive and efficient mobile method of pain relief. It emits tiny electrical impulses that come out of the machine through a wire that looks no different than the microphone wire, called an electrode. And those go to little pads that stick to the skin. And that transmits the electrical impulses through the skin, and it's called the pain gate theory. It does some depolarization of pain channels, and it alters the way that the brain sees those signals of pain. Fancy way of saying that it helps decrease pain, okay? And they work really well for acute and chronic pain, such as low back issues, like if you throw your back out over the weekend and you have a sprain or a strain of your low back. It can help those muscles relax, stop spasming, and decrease pain. If you have had failed back surgery, or you have a condition like arthritis that flares up every once in a while, it can work well for that as well. So it's inexpensive. A lot of times insurance covers it, and if not, these are not overly expensive items. The office sells them, I think, for less than $100. So that's one way to do it. It is important to see a doctor, whether it's a chiropractor or an MD, to get this thing properly programmed before you use it, because they can look at you, examine you, and basically set you up with the proper channels. And you don't want to use it all day, every day. You want to use it for a couple hours on and off. Otherwise, it can be detrimental. But it's a very low-risk device. It may bother your skin a little bit. You need to be careful about that. You shouldn't use it on your face. You shouldn't use it over an open wound. You can use it, just check with your doctor first. Like if you've had surgery, you can use it outside the incision to help with incisional pain. All this should be clear with your physician, by the way. Check out our website. There's a whole page on TENS units. Shows some pictures. A lot more questions are answered on there. But they really are remarkable devices. Inexpensive, effective, low risk, and non-operative. I mean, what better way to decrease pain? I'm Dr. Green, Preferred Pain Center. Your pain stops here.